अस्सलाम वालेकुम। मैं हूँ डॉक्टर ज़ैनब, कंसल्टेंट गायनेकोलॉजिस्ट एंड फर्टिलिटी स्पेशलिस्ट। अगर आप लोगों को मेरी आवाज़ क्लियर आ रही है तो प्लीज़ येस का मैसेज कर दीजिएगा। और हेलो, hello.
How are you? Can you hear me? You can hear me?
Yes, yes, I can hear you very well. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. How are you?
I am fine. So, ladies and gentlemen, my audience, I am Dr. Zainab here again in Sunday Special with my special guest. I welcome Dr. Zainab Yunusa in my live session, and I will introduce my guest as she is a plastic surgeon by profession, and she is wellness fitness coach as well, and she belongs from Nigeria. And more detail of her introduction from start of her journey, from start of education, will be discussed by her herself. So I welcome you in my show. Thank you so much, Madam Zainab, for coming in my show, for giving me your precious time. I thank you from the core of my heart, and I will be happy that you share all your journey since from your childhood till your specialization and becoming a plastic surgeon in the country like Nigeria. Please share some insights to our audience.
Thank you so much for inviting me. I really appreciate the opportunity. Thank you, everybody. And it's good morning here in Nigeria. I'm from Gombe, Northeast Nigeria. As introduced, I'm primarily a plastic surgeon. I work full time, but then on the side, I also work as a fitness, wellness, and well-being coach. Okay, so I was born, I've lived most of my life in the north of Nigeria. And if anybody has read anything about girl child education in Nigeria, you know that girl child education still has and a lot to do to progress in Nigeria. I don't know, one of the things that hit the news some years back was that we had this really terrible insurgency where over 200 girls were kidnapped from their school. Until date, not all of them have been rescued. So, girl child education is a big topic in northeast Nigeria. Okay, so I was born in a place called Kaduna, that's northwest Nigeria. My dad was a commissioner for health. My mom was a nurse, and they come from different parts of the country. And so I grew up with a mix of cultures, typical northern culture, and my mom is from the north central part of Nigeria. And so it was nice for me growing up, not realizing that what was normal for us was not exactly normal for everybody. My dad, my late dad, was Muslim. My mom is alive. She's Christian. And we had a mix of everything. And we saw it as normal. We didn't think it was anything. I had a very productive, very happy childhood. We lived together in peace. And then my mom, being a nurse, naturally drew me towards healthcare, set the tone for me going into healthcare. So for my elementary school, because my mom was a nurse in Nigeria military, So she was getting posted around the country, and we were moving with her. So I was about 3 when we moved, and then we moved to another town. I started school there. We were there for about 3 years, and then we moved back again to my birth city, Kaduna, because she decided she wanted a voluntary retirement. She didn't like all the transfers, the frequent transfers that she was having to go through. She wanted a more stable place for her children. Hence why we moved back, and she voluntarily retired from Nigeria Army. And of course, she retired from the nursing profession and went into business full time. And by the time she retired, I was just about getting into secondary school. But all along, I was already, I don't want to use the word indoctrinated, but I like to think that she actually wanted me to go into medicine. So, and then of all my siblings, it's my immediate older sister who went into something medical medicine related. She read vet medicine, so you can imagine that that was already drawing me into medicine. And then another older sister, after she finished her first degree, went back for medicine. So you can imagine that my journey was not totally unbiased. I had people that I kind of followed. So I got into medical school. I finished secondary school, uneventful, got into medical school. But sometime before I got into medical school, I had made up my mind I wanted to do medicine and I wanted to do surgery even before I got into medical school. But I wanted to do orthopedic surgery, not plastic surgery. But by the time I was starting, incidentally, my first posting as a clinical student, first year clinical student, was surgery. So I think that sealed my faith that I was definitely going to go into surgery. If you need me to slow down, do please let me know and then I'll slow down. Okay. So surgery, and then when I went through orthopedics, I was still like, oh, that's where I want to go to. That's where I want to go to. Well, as at the time I finished medical school, I still thought I was going to do orthopedic surgery. At that time, it was the same entry exam into surgery residency program for everybody who wants to do surgery, who wanted to do surgery then. So I got in, and there was some incident. You know how there's always some kind of political thing going on. I wasn't involved, but I had to go on leave just before I resumed my orthopedic surgery posting. And then one of my colleagues went to cover for me for like the 1 week before I came back from leave. And unfortunately for him, he got into some kind of political tangle between the trainers then, and he had to suffer it. And when I returned, the first thing he told me was, just remember to tell me when you're going on leave so I know to apply for my leave and I don't get into trouble for something you were supposed to do. When he told me the details, I was like, okay, I'm not sure I want to go into orthopedics anymore. And then when I did my plastic surgery junior residency rotation, I just fell in love with the consultants. They're very pleasant people. They want you to learn. They're they're not just about your academics. They want to know that you're all around happy. How is family? How is everything? And I think that sealed my faith in plastic surgery. So I went into plastic surgery, and my residency was uneventful. But somewhere, well, not but I got married like halfway through residency, had my baby, like first year of senior residency program, had my first baby. And my consultants were, it was as if their daughter was having a baby, the way they treated me. It was a fantastic program. I had very supportive colleagues, both the junior and senior ones, and my teachers. So my residency was good. And then I finished residency and started work as a consultant plastic surgeon back in the Northeast. My training was in the Southwest of Nigeria. I got back to the Northeast, and practically, although I had a colleague who was there some time before me, but we practically built the specialty from start because there was no plastic surgeon in the institution at that time. So we started to build the specialty from start. And one of the things I really enjoyed was that my own teacher, my professor that taught me residency, the most senior of my trainers, he trained abroad. And when he got back, because he had very wide skills that covered a lot of specialties that went into urology and so many things. A lot of other consultants, when they got stuck, they, they had the tendency to push patients that they didn't know what to do to him. And he was doing them, but while we were training, he made sure to emphasize that don't take on what you know you cannot finish. And it was a very important lesson for me because by the time we started the plastic surgery specialty, there were only two other specialties that were established in the institution at that time. We had general surgery, we had orthopedic. The others were visiting consultants, so we didn't have a dedicated specialty outside general surgery, urology, sorry, after general surgery, orthopedics, and then plastic surgery. So there was a tendency for other specialties to send us just anything. So we had to establish the unit and then establish what we were not going to do. So initially, they were sending us such things as ingrown toenails. They were sending us such pathologies as necrotizing soft tissue infections, and it was a bit challenging to get them to realize that we can do this, but we don't do cases just because we can. We do cases that we know we want to do, and it is within our specialty. And luckily, most of those things have been resolved now. Occasionally, yes, we do have cases that will come. For example, in the last clinic, we had this young adult who has lipoma somewhere in the lateral chest wall, and she was really worried. She was very anxious about it because she's immunosuppressed. She's on antiretrovirals, and any small lesion on her body, she's scared it's a malignancy. So she was really worried, and telling her to go to clinic so that she could get booked for the general surgeons to see her was going to delay the time when the lesion was going to come out. So we just decided, yeah, it is general surgery, but it's something we can do. So we did that. So even though it's something that we have decided in the department that this is not plastic surgery, we still do a few cases like that just out of empathy for the patient. So now, as a plastic surgeon, my I initially started in academia. I joined the local university. But after 1 year, I had to leave because the heat of the politics of academia was too much, and I didn't like the idea of the publish or perish thing. So I decided, you know what, I enjoy doing research. So I'm going to do it on my terms. If I decide I want to publish just 2, 3 papers a year because my promotion is not dependent on it, I'm really fine. So hence why I'm enjoying working with Author Aid, where we met. And I love working with Author Aid because one, you learn a lot as you're teaching others. And the gap, we're both from the global south, the research gap is so wide, not just in terms of output, but in terms of quality of research that is being done. And one of the core principles of Author Aid is quality research. You don't just teach research, you teach quality research so you can get quality output and hope to bridge the gap to some extent between the global north and the global south. I do a lot of talking, so I'll just stop here, except if you have another question for me.
Yes, I want to clear one thing that I used to go for a question answer session in the evening on Sunday. So this is not question answer session. This is the interview session, and the audience who are going to put questions, I request you to break stop that questions, and I will again will be live after 9 p.m. in Pakistan, and I will take your questions one by one, and I will give answer. So this is not question answer session. This is my live interview session, and I am going to interview my guest. Zainab, I want to know about more about your siblings and your childhood memories, your hobbies, your childhood in your childhood, and you said that you have a very happy and very energetic time in your childhood. So I would like to know what type of circumstances and what type of environment in the past in your childhood you have memories about that, and how as in Pakistan, in Pakistan now there is a very in our time when I was a child, we used to play each with boys and girls play together, and we used to play for many hours, for 2 to 3 hours in the morning and in the evening, and there was no restriction from our parents, and we have enjoyed a lot in during our childhood. But after now I am 30, more than 35-year-old. Now I see that my children are not allowed to go outside. We don't feel secure that the kids will get hurt, or they will go, if they will go outside, and they are more on the TV and on the cartoons and on the games. So what you see your children now, you have children, and during your childhood what was the environment, and how this environment has been changed in your country as well or not?
I love that question. I really love that question. When we were children, of course, you get up in the morning, you go to school. My school was not very far, so sometimes we got taken to school, but like 90% of the time, we walked to school. It took us about 10 minutes to walk from the house I was in. That was my primary school, to the school and back. In passing through, in going to school, we didn't have to cross any major roads. Most of them were footpaths and dirt roads. And then we'll pass through like a mini market, because I told my mom was in the military, so it was a military school. And we'll pass through Mami Market, as we call it, and we pass through a part of the military barracks. And we didn't think, in fact, it never occurred to us that something would go wrong. I don't think my parents were ever worried if, excuse me, we would get to school. It was a matter of, I hope they will not stop to play on the way back from school. That was their major concern. Everything was so free. And when we got back from school, we will, of course, eat. If there's, by the time we're old enough to do a few chores, we'll do chores. And then we're outside playing with the neighbors, boys, girls. We didn't even know there was anything about difference in tribes. We didn't know there was anything about difference in religion. We didn't even think that gender was anything to restrict us. We would play. I still remember playing in the sand. At one point when I was growing up, my house was the house, our house, we're building like an extension because the family was now with children were growing older and we had a lot of space. And we were building like another like um, bungalow within the same perimeter fence. And so there was always like heaps of sand because of reconstruction. And I used to really look forward to coming back from school because then we'll build houses out of sand. Sometimes we'll use our hands to dig. I still remember that one of the things that I that I still remember and laugh at till today was during the rainy season, when you're digging in those sands, you find these tiny things. And one day I took like three of them and took them to my grandma. I was like, Grandma, look what we found. What are they? She said lizard eggs, and I wanted her to fry them for us. She was like, no, you don't eat lizard eggs. And to my surprise, I was asking my son, who is 10, he had never seen lizard eggs because, just as you said, there's such an indoor generation. They hardly know what is going on outside. It's really scary and it's very sad. And so that's one of the things that, as you said, our parents were not worried about anything happening to us. But right now, to let my children go out and play, I want to know where they're going to. I want to know who they're playing with. And I tell them, if you need to go from that friend's house to another friend's house, come home and tell me or call me before you go anywhere, because we're so worried that something would happen to them. It's really scary. And for me, I think it's limiting how much childhood they're getting. I don't think it's a normal childhood when you cannot play free like you would want to. It's scary, really scary.
Yes, and same happen here, and we have a culture in Pakistan. We have a culture. When I got admission in my pre medical school, that was co-education, first time after my primary and secondary school matriculation. My mom told me that you have not to talk to any boy. You must be careful that you should you have limits, you have some boundaries. And after making these 2 years of free medical, I got admission in medical college. And I remember my mom always told me that remember that I am not going to see you or watching you in hostel or in college, but your Allah is going to see you. You have your boundaries, and remember your boundaries. You are a girl. You are not, you have no right to enter in any room of, even in your professor's room, with alone, as there is shaitan always with you. So I was very feared about that. And I spent my whole 5 year of medical school with that fear that I used to talk with boys. I used to have different extracurricular activities like speeches and games and all the things. But I always remember that I have my religious boundaries, and I cannot go for that beyond that. But that training that I got from my mother and from my house, I am going to see that now in the same medical school, in the same medical college, the traditions are going to be changed very fastly, as as the culture of internet and social media in Pakistan is like epidemic. And the people think that they should not have any boundaries, and they have no any other person have no right to say uh, good or bad to him or her. And the things are changed very fastly within 5 to 10 years, as I have seen. So I want to know that in your culture, when you was in medical school, how you deal with such type of things, and whether it was co-education or not, and what was the environment you faced in your medical school, and for how much tenure it was, 5 year, 4 year. And so you what was your culture in Nigeria in medical school?
So the medical school I went to is like the oldest medical school in Nigeria. We're very
Yes.
proud of it. We tend to tell the other people that we say there's only one medical school in Nigeria and the others. So we say our medical school is the medical school and the others went to other medical schools. But it's a typical represent. It's typical of what other medical schools are. All universities, government-owned universities in Nigeria are co-education.
Co-education.
So yes, for the although you've got for the preclinical school, you tend to stay in the main university campus, and you have separate hostels for girls and boys. When you cross to the clinical school, you have one hostel, but then you have different blocks for girls and for the boys. So there was some separation in sleeping arrangements, but every other thing was the same. We shopped from the same cafeteria. We ate in the same cafeteria. We shopped from the same place. Our classes are the same. Sit next to each other. We play games together. So that's typically how it is in different parts of Nigeria. But depending on the culture of where you come from, for example, um, northern Nigeria has a very large Muslim population, so you have a lot of Islamic influence. So, like where I went to school in southwest Nigeria, you have a very large population of Christians, and it was normal for you expected to conduct yourself within the level of what is accepted as decent. And so you go to school, you play. If you're going to play games, for example, I played a lot of volleyball when we were in clinical school, and we never had any segregation of the genders. You're on the same team, you have some boys and some girls. When we're playing, not formal games, just your normal recreational ones that we play in the hostel, we play with boys, we fight with them, we didn't think there was anything wrong. But that's hard, not likely to be very commonplace in northern in the universities in the north where you have a lot of Islamic influence. Although I'm aware that things, as you said, are beginning to change. So I'm sure you would find it once in a while, but not as commonplace as you would find in the kind of university I went to and then in other areas of Nigeria. The northern part is where you have a lot of Islamic influence, and then not southern parts of Nigeria, less Islamic influence. So you're likely to see those subtle differences, but essentially all universities are co-educational in Nigeria. So we
Okay.
played a lot of yeah, yeah.
So you have said that during your residency you got married. It was a love marriage or arranged marriage? Tell me a little bit details of your marriage as well.
Nigeria does more of love marriage than arranged marriage. Even though in northern Nigeria you do have more, you do have if you have cases of arranged marriages, but most times in Nigeria it's a love marriage. So I met my husband just almost a year before I started residency program. Had gone to resume work in a hospital while I was waiting to start residency because you have to sit for the qualifying exam and then apply to an institution and then wait until you're called upon. So I was waiting. I had done the first part of the interview. I was waiting for the second part that is oral, and that's when you know whether you've been taken. So I went to resume work in the hospital where I currently work. And um, I decided it was my first day at work, and I thought, let me just go around and find out how things work here. And then I walked into the accident and emergency department, and then there was this young man there, and I was asking him that, okay, so I'm a new staff here, and I just want to planning. I'm waiting to leave. I've just got a job here, waiting for when I'll start residency. And he was like, oh, he's also in surgery department. He's also into surgery. He's in residency in surgery, and well, the long and short of it now, it's going to be 20 years in December and 3 years after we're married. So we're married for, by December, it'll be 20 years since we got married. We have three children. Our oldest child, oldest child is a boy. He's going to be 18. Then I have one daughter, and then the little one I told you about. I said when he's going out now, I want to know where he's I want to know where he's going to. I want to know who he's playing with. Okay.
So you have two children, one daughter and one
Three.
son.
Three.
Okay.
One girl and two boys.
Okay. So all three are school going.
I'm sorry, I didn't hear that.
All the three children are school going.
Yes, they are. Yes. My oldest is in university. He's actually schooling in India. And then the second
Okay.
one is just finishing secondary school. She's finishing officially on Wednesday. And then my youngest is finishing primary education this year. So I have a
Yeah.
mix of them.
Okay. That's that's great. So you have told me that you are a fitness wellness coach as well. So
Yeah.
tell us about that. That is your hobby, or you like it, or how you spare time? You are a full time practicing plastic surgeon. How you spare time for this? Your wellness coach or fitness coach.
Um, Thank you so much for that question. I I've always been a sporty person. I've always liked the idea of doing. I've always dabbled into one kind of sport or the other. And you remember I mentioned that I used to play volleyball when I was in university. And if I heard at one time I dabbled into, there was some arrangement for karate. I was there briefly. And so I always wanted a place where I've always wanted to be into some kind of fitness stroke exercise thing, but somehow I never got round to it. And then where I stay in northern Nigeria is, well, we like to say that my place is called Gombe. We like to say Gombe is an urban area, but I like, I think it's semi-rural. So, and you know how they say that if you want something and it's not available, that you should create it. So I decided, yes, I want to be fit. There is no, what I want is not available. So why not create it? So as at that time, we had only one gym in the whole of where I stay, at least one functional one. We had a few who had that sprung up and collapsed along the way. And then I decided, okay, so what can I do to create it? So I got a few colleagues together and I asked them, those I know that have some interest in sports. And I spoke to them. One is my colleague, a plastic surgeon. The other one is a cardiologist. And then one is a physiotherapist. I was like, why don't we form a partnership and start a gym? And then whilst we're planning the planning process, trying to work out a business plan, I thought, wouldn't it be nice if all of us also got some certification as fitness, at least instructors, so that we know a lot more about the business than just being the owners of the business. And some agreed. So some agreed and actually finished the certification program, some didn't. And so we started that. And then we realized, wait, there are people who would not want to go to an in-person gym. They want to be fit, but they do not want the trouble of going to the gym. I was like, good. So now that there's internet, we could actually do online. So I started an online fitness business, online arm of the business. So we have 12 classes a week now. And initially it was just aerobics because we didn't want people to have the excuse, oh no, I do not want to buy any expensive equipment. Oh, I don't know where to get this equipment. So like, come, we can do body weight only exercises. And a lot of people really loved the idea. So we started that. Then we now had some people who would say, as I told you, this part of the country, there's a lot of Islamic influence. So some would say, oh, I do not believe in music, so I do not want music. And those who do not feel the same way say, oh, please, we want music in our classes. So I spoke with a friend who now introduced me to another friend, and then we now introduced dance classes. So we have dance classes in online, all online, virtual. We have people that are even outside Nigeria signing up for the classes. So it's been almost 2 years now that we started this, and it's been really fun. I get a lot of feedback about how this has helped. And the part I'm most proud of in being a fitness coach, especially an online one, is I get colleagues, physicians who signed up for the program and they're like, it's been just 1 month and my back pain is gone. If I have a client who was scheduled to have back surgery because of really bad back pain, and 6 weeks into the program, she's been completely off medication. She's not had surgery. And she told me one time her physiotherapist saw her and asked, we haven't been seeing you. And she was like, oh, I don't have the pain anymore. So it was a really big discovery for me that a lot of the back pain we have is just the need for us. It's just for us to move around a little. Our life is becoming increasingly sedentary and is bringing us a lot of lifestyle diseases. So that was how I got into the fitness arm of the business. Then for the life coach part, I went through some difficult patch in life. And even though at that time I wasn't a life coach, I knew that it was not my fault. But at the same time, I was hurting from that condition. And somehow I came across this post by, I've heard it being attributed to so many people. I've heard it attributed to the Buddha. I've heard it attributed to so many people. But essentially, what it says is that pain is inevitable, but suffering is optional. That was very deep for me. And then I started to go deeper and deeper. I was exploring self help, personal growth. And then I realized, oh, I was able to not only resolve the problems I was having, I was actually able to help people. And I decided, wait, why didn't you just get a certification and you can do this, you have authority to do this. If you decide you want to do it free, fine. You want to decide if you decide you want to um, make money out of this, fine. So I went, I got certified as a life coach, and it's been fantastic. I get invited to give talks here and there, and it's been excellent. And then my fitness clients now started to say, "Oh, I lost some weight after joining your class, but I still want to lose more, and my weight has become static." And we all know that weight loss is about 70% diet, 30% exercise. And incidentally, the mathematics is right, because I've realized that most times by the time they lose a certain amount of weight, the weight just becomes static, no matter how consistent they've been with their exercises. So I decided to go in and get certified as a weight loss coach. And then I started to do that, and my clients are seeing results. So that's why if you see my Instagram videos, I introduce myself. Hello, everybody. This is Zainab Kaltungo, plastic surgeon, fitness, wellness, and well-being coach. So I have wellness all in one, fitness as a life coach, mindset shift, and then a weight loss coach. And I still work as a plastic surgeon full time. So
Yes,
yeah.
that's great. That's great. That I think that's why nature have put this instance and this to meet each other, that I have a very interest in this personal development and self help books. I have learned during the start of the COVID. I was a very busy gynecologist, in obstetrician, being obstetrician and gynecologist, we have no time. We are going running for the surgeries, C-section, normal deliveries, and emergency dealing, PPH, APH, very much hectic lifestyle I was having before the start of COVID. And I was having my government job, my private clinic as well, and my kids and all that. And all of a sudden, when COVID started some 3 years ago, I stopped my clinic, I closed my clinic. My duties, where I go daily for duties, now I go for once a week. Due to COVID, outdoor clinics have been closed, and elective surgeries have been postponed, and only emergency duties we were doing. And I was in stress. I was in acute anxiety at that time. And one of my Facebook friend, that was senior to me from UK, and he was a life coach. He is a life coach. I have interviewed him a few months ago. I booked a session with him to discuss all the situation. I was sleepless. I was in terrible condition, in a state of fear that once one a day I will not come back from hospital. I will got COVID and I will die. So he talked to me for 10 to 15 minutes, and everything finished. My fear gone, and I was just like a normal human being. And I was shocked that what did this man did with me. And he did nothing. He was having only one question. I said, I am very afraid of this COVID pandemic, and I don't want to go to my duty, as I am afraid, I am in a fear. So he said, mm, after taking a pause, he said to me, uh, are you a Muslim? I said, yes. He said, so being a Muslim, to whom you should be afraid of? I said, repeat your question. And I think in a moment, I think I should be fear of only my Allah, only my God. He is the creator. So he said that he has created that microscopic and virus, and he know who will be hit or who will not be hit. So you have your life. You are doctor. You should be faith that the life is in the control of your Lord, not in this virus. That's finished. And after that, I started this my work as a I started online work. I started my Facebook page. I started my YouTube channel. I think that whatever knowledge and skill I have, I should share with the public, for the sake of public benefit, for the sake of people benefit who don't know about the health precautions, health preventions, and fitness as well. So I am very thankful to COVID that created this in my mind. Otherwise I was having a very bad lifestyle, and I was not having a time to sit and to think anything. So this was this was the scene. And now, after taking many online classes on this life coaching and on this neuro linguistic programming, NLP, and all that, I learned that balanced life is all that we should put in mind, that our health, wealth, and relationship, when these three things will not be balanced, uh, people usually move and put all their energy in one thing, whether in health or in relationship, or in less on less priority on health. So the balance is very necessary, I learned. So I am very happy to know that you are a life coach, you are a fitness coach, you are a weight loss. And you said, I joined at that time I joined gym as well, where Zumba classes take place and dancing exercises take place, and I used to enjoy all these classes. And now I shifted my profession from obstetrician and gynecologist to PCOS expert and infertility expert. And in PCOS, all the patients are mostly more than 80% patients are overweight. So I used to go in depth in research in what are the causes of this weight gain, and I found that most of the time these are emotional causes.
Yeah,
Women are not going to eat very much. They
yeah.
have emotionally deprived, they have some emotional problems, and that causes them to have adrenaline rush. So I would love to know if one I have many patients that have this weight problem, that have this fitness problem. I would love to know how they can join your classes, as you are going to give online classes. So my Pakistani patients, my Pakistani audience are going to listen you. If they want to join you, please send them link so they can join you. And how much fees you take?
Oh, very, very. Our fees are very small, very, very small. So, for example, our because we have some people will say because they do not want music, they want just the aerobics class. That's for the group class now. That comes to about $7 a month. So it's really cheap, very, very cheap. Yes. And then for those who want the ones who want the dance class, because for the dance class, we don't restrict ourselves to a formal kind of dance like maybe Zumba. We do have occasional Zumba classes, but it's mainly cardio. We do mainly Afro fusion. So you dance and you would know you have burnt a lot of calories. So that one is about $12 a month. So our package is really affordable. And then if you're, because we want to encourage people to be motivated to stay connected. So we have a package where if you pay a 6 months package, that's for the fitness arm. You can, if you pay a 6 months package, you still get it at that $5. You pay $5 for 6 months, which is about $30, and then for 6 months. So it's a really affordable package, very, very affordable package. Yes.
Yes, yes. And at the end of the session, please send me all the links so that
Okay.
I can put my description and the people
All
can
right.
join you. That's amazing that a plastic surgeon have interest in fitness, and I would love to share your Instagram profile as well on here, so that people get benefit. And
Yeah.
I observe that you are very smart. So you do exercise regularly, I think.
Thank you. Yes, I do. Yes, yes. I exercise at least 5 times a week.
Yes. And this backache problem is very common in Pakistan. Every next woman, every second woman have this backache
Yeah,
problem. We used to
yeah,
give calcium, we used to give vitamin D, ampules, we used to give multivitamins. But due to lack of healthy lifestyle, I think this ratio is going to be increased. And
yeah.
I used to prefer give preventive measures rather than curative measures, that you should go for exercise. And I used to give my example that I have changed my lifestyle after this. And now yesterday my patient was asking me that you are going to become very fresh, tell me the reason. I said early morning rise. You should rise up early in the morning with sun, and you should take vitamin D, and you should take oxygen from the plants, and you should nourish yourself. And that is the only reason. I have observed that that has changed my life whole on a whole perspective, and my way of thinking as well.
Yeah,
So
I
now
hundred percent.
I appreciate you. You are going to do it on a bigger level. I am impressed by this plan of your business plan as well, that you have made a team of other peoples, and you are going to work with them as a lone person cannot do all these things.
Yeah,
So
yeah,
how you
you're right.
make this team? Your team members also go give training to live sessions, or and how do you manage all your time uh, despite of having a plastic surgeon? You go for long surgeries. I know I have many friends, plastic surgeon here. They go for surgeries for many hours. So how do you manage your time?
I like that, and that's just the word. Manage your time. So, for example, I prepare to work out very early in the morning. So the classes I take, I prefer to take very early morning classes, and even when there's no scheduled class, I prefer to work out early in the morning. So right after Fajr, I get up, say my Fajr, make my duas, and then I do my workout. So before the household is awake, I'm done with my workout. I'm ready to hit the road. Then then my colleagues, my those that I work with that conduct the online classes, one of them does a shift and closes at 6 p.m. So she does the 8 p.m. That's 8 p.m. Nigeria class. That's for the group session. For the individual sessions, we like to work with the clients to suit their time. Because as you know, if you do not do it to suit their time, then they're not likely to be able to follow up. Good. So we work with them. That's for the individual clients. But for the group clients, for the group sessions, so the person closes at sometimes 6, sometimes 7, and then they take the 8 p.m. class. And there's another one that closes from his daytime work because all of them have daytime jobs. And then they do the online class from 9. So we're able to, and we find that we're able to get a lot more people. So if you are not a strictly morning person, no, if you prefer mornings, then there's a package for you. If you prefer early night, we have a package for you. And if you prefer late night, there's a package for you. And for those who want individual sessions too, we can help them. Yes.
That's great. That's great. So I want to know your current routine after early morning workout. What you do next?
Okay. My youngest child, because of the way life is, I I refused to take a driver. So I take him to school, except maybe comes, when work interferes with my schedule. So I drop him at school in the morning right after we're done eating, and then I drop him in school. And then from school, I head straight to work. So most times work starts at 8 here. And by 7:30, most times I'm already settled, waiting for work to start, and then I do my work. For the days when my elective operation list is on a Thursday, so what I do most times, because then my elective tends to spill into school time, so I will ask either my husband or a neighbor to pick my son up from school, and then when I close for the day, if I have any running around to do in town, some webinars, some lectures, I attend to those. And if I'm not on call, most times by 7:30, I'm at home. But if I'm on call or it's my elective list extends, I've had my elective list extend until 2 a.m. before because we're doing a really long surgery. We do that too. So essentially my routine is work. I'm not the kind of person, I'm not like a partying person. So except if it's the wedding of a close relation or a really close family friend, I hardly ever party. But that's my life because I know social you and I know as life coaches that your social connections are very important for your well-being. But I like to think I'm some kind of mixed introvert extrovert. So I like my time alone. I really like my time alone. So most times, except if there's some close family or friend engagement, I'm back home. So it's home, work, back home again for me.
So, despite of all these works you do you have any household chores you have to do in house, or you have some servants to do?
Yes, I do have some. I have a living help, but because I realized that I also need to do my bit, especially to be an example to the children, I do household chores too because I want the children seeing me. I want the children to see me doing it so that they realize, oh, mommy doesn't just tell me to work and she's just lying down. So, for example, I had a little just before this session started. I had a little clash with my 10-year-old. Just about a month ago, I started to get him to iron his clothes, and it's been a battle. And I told him, if you do not iron, then you cannot go. He loves football. You cannot go and play football outside. So well, he said he'd iron the clothes. I saw the clothes. It was not a very good job. He didn't do a very good job, but at least he knows he has to work before he goes out to play. So
That's
that's essentially what I do. Yes,
that's great. That's great. Because we are role model for our kids. So what we do,
yes,
they will follow it. That's
yes,
great.
yes, 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 yes.
So you have mentioned that you have interest in research, and you are working on research as well. How many
Yes.
papers you have still till now, and
Uh,
currently you are working on which topics?
yes. So as I said, I've always liked the idea of research and the way the medical school is structured in Nigeria. You don't, apart from your journal club reviews that you do as a medical student and then as a resident doctor, except if you worked with a consultant who pushes you, or a trainer who pushes you to go into research, you're very unlikely to do much publishing before you finish residency. And I've always loved the idea of publishing. So what I did was just give me a second. I need to. There's about to be some background noise, so I want to change. But you still be able to hear me clearly. I just want to change so that. Okay, good. Hear me? Can you hear me?
Yes.
Okay, good. All right. I had to use connect headset. Okay. So because I wanted to do research and I started work as a consultant, as a hospital consultant. At that time, the local university had not opened. So what I did was I asked around how I could get help. And then I saw a case. I wanted to do a case report. And as at that time, I didn't know how to do a proper case report. So I spoke with a senior colleague of mine who's a pediatric surgeon because he was in a child with a cleft, and I wanted to do a case report. And I spoke with him, and he was like, "Oh yes, I'll be very happy to help you." And he was co-author on the paper, and I got my first paper out then as a second year consultant. And then that's when I started to ask around. And then one of my senior colleagues told me about Author Aid. His very good friend was one of the partners, not partners, he'd worked with Author Aid in one capacity or the other. So he sent me the link and I signed up. And incidentally, there was going to be one of their MOOCs, one of the massive open online courses. And then I signed up and I enjoyed the course so much. I participated, and by the time that time they used to do the course twice a year. And by the next one, they invited me back to come and act as a facilitator. It's a 100% volunteer thing. And because I enjoyed the work so much, I participated. I've been invited to work as various on different capacities in Author Aid. So I'm currently now an Author Aid steward. As an Author Aid steward, some of the things you do is an auto aid event, you might be the one to facilitate or host them. Then, in addition to being a steward, we have an online journal club that you're aware of, the one where we're going to be discussing one of your papers later in the year. So, I'm the coordinator of that online journal club. So, I just love the fact that I can still do the research I want without the pressure to publish or perish. Yes.
Yes. Great. That's great. So one of my senior have told me about author aid a few months ago, and I learned a lot from this link, and it is a different world of
Yeah.
research,
Yeah.
and
Yeah.
entered inside. You think that this is all. are different,
Yeah.
and and much more learning opportunities here on author
Yeah.
aid.
Yeah.
And I was not very much familiar of these websites before that. So randomly I choose your I select your profile and send you an email. And now when you answered me, I was very happy. So being a learner, being a new in this field of research, what will you advise me? Should I take the this MOOC massive online course for learning more about on research? Because as I have told you, in Pakistan, research culture is not flourishing in Pakistan, and only few people are going to do original research, and
Yeah.
we have no uh, we have no exactly saying we have no mentees, so we can learn step by step. Although we
Yeah.
have many patients in our hospital, many patients, I can get data collection. I am very experienced in data collection. In the past, I was undergraduate president of research society. So but stepwise, I want to
Yeah. Okay. I think my network is fluctuating. I cannot hear you anymore,
take.
but I think I totally get your question. So my suggestion for anybody, whether you're experiencing research or not, is I would suggest you take the online course. Why? A lot of the things that will be taught there are rudimentary, but then there's the part that is called the discussion forum in the course. That is where it's, for me, I find it's like a gold mine, because that's where a lot of people will share their experiences. You will learn a lot of things that you didn't know before, and then you learn a lot of problems that others are facing, and then you can now create a solution for them, and then you can teach your junior ones so that they don't fall into the same pitfalls that they encountered. So, for example, we had a webinar, auto aid webinar, that I was one of the speakers on about 2 weeks ago. It's about predatory journals. And we also, so when one of those who attended the course now went to the Biomedicine and Healthcare Journal Club and said he needed to share his experience, and that he was very glad we had the conference because he had never heard of predatory conferences. And he was invited, he published a paper, and when he published the paper, somebody wrote to him out of the blue that they're organizing a conference and they've seen his paper and they wanted him to come and be guest speaker on the conference. They mentioned the name of the hotel. He was supposed to pay conference fee, and then they will pay for his flight and accommodation, which sounded like a really fantastic deal. So he tried to get a visa. I think he said the conference was supposed to hold in France. He tried to get a visa, but he couldn't get a visa. So he wrote to them that he was unable to get a visa. So they said, oh, he could. There was going to be another conference, and that they will also do give him the same benefits. They'll pay for his hotel, pay for his flight to that next hotel. And I think, if I'm not mistaken, when he realized it was going to be difficult for him to make it, he now asked for a refund and he never heard from them again. So it was a predatory conference. There was really no conference like that. So you see, we didn't have that, if we didn't have that discussion, I would have been surprised that somebody could fall for that kind of thing. So that's what I said, that you learn from the experiences of a lot of people, even though you are an experienced researcher, you will learn from the experiences of other people, and then you can help to educate your own proteges so they don't fall into the same problem. Yes. So
Yes.
I would advise that you sign up for Author Aid and take one of their courses, learn a lot from the discussion forum. Then also attend a lot of the events. For example, we have this informal event we call Tea Time with Author Aid. There was one last week, and it was the topic, because it's supposed to be an informal session, but it tends to get a lot. You learn a lot, and the topic of the last one was about networking for research. And then we found at that one that there's a lot of people still do not know how to go about asking for research collaboration. So because of that now, we've learned that we should do a follow-up session that will bring people to talk about how they go into their own research collaboration so that others can learn. So each time you attend an author aid event, you learn something new and then you can build on it to create your own space or better the space you're already in. Thank you.
Thank you so much, Zainab. Thank you so much. It was a nice
Okay, I think I can't.
discussion,
Okay,
and
all right.
we have
I couldn't hear you. I can hear you now.
away. It's almost 1 hour. I took your time for 40 minutes. I am very thankful to you. I learned a lot from you, and my audience will be get benefited from this interview as well. And I hope in future you will give us time for another one session, because there are a lot of things that need to be discussed again
Yeah,
in
I
some.
agree with you. I agree with you 100%. And if I may suggest something, I think it would be nice since you're also a life coach that will sit down and talk about problems that we think a life coach can solve for the medical community. Because I'm sure you found out that a lot of your colleagues, doctors, who are
Yes,
supposed to know better, do not know about balancing life. So I think that would be a nice one for us to talk about. Think about
thank
it.
that's great idea. That's great idea. I will.
Thank you.
And I would love to share all your links for the people benefit. And I thankful again to you for giving me time. And in the last, if you want to give message to our public audience. uh,
100%. I thank you so much. First of all, I need to say a really big thank you. I enjoyed every moment of the interview. And my general message for everybody, I'll just advise you if you've never heard of what we call the serenity prayer, I would advise you that you learn it. And what does the prayer say? The serenity prayer says, Lord, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. If you can live by this mantra, irrespective of what your religious beliefs are, these things fit into it. Just as you were saying earlier that when you were afraid of COVID, your friend, the coach said, what can you control it? What are your beliefs? So if you believe that these things are out of my control and I'm not going to give energy to them and get stressed by things I cannot change, life will be so good for you. So everybody, please learn the serenity prayer and live by it. Thank you. That's my parting word.
that's great. That's great. Thank you so much again.
Thank you.
And
Thank you.
time to say goodbye.
Thank
Allah
you.
Hafiz.
It's been a pleasure. Assalamu alaikum.